Hi, I'm Dave Fornell, a editor with Radiology Business, and I'm here with Randall Thompson. He is the immediate past president of the American Society of Nuclear Cardiology, an attending cardiologist at St. Luke's Mid-America Heart Institute, and a professor of medicine at the University of Missouri, Kansas City School of Medicine. Do you have any predictions for the future with advances in nuclear imaging in the next few years? I know there's been big advances with PET and new innovations within PET to try to add additional information about the patient.
In terms of prediction, the prediction I've been mentioning in talks lately is that I think the field is going to become quantitative. And so I think we'll have greater use of PET, absolute quantitation of myocardial blood flow, for example. It's a very powerful prognostic tool, a very, very powerful tool. And coming along is SPECT, absolute quantitation of myocardial blood flow. That now has or it's about to get a category 3 CPT code for reporting. And it seems to be moving along very well with developmental efforts. There are obviously a lot more SPECT cameras than PET cameras, and so assuming that we can get to a point where that's as useful, it is almost as useful as it is with PET, I think it'll be using a lot. That'll change the field. That's the only prediction I can make at the present time. In terms of other things, the better use of equipment, the combination with function and anatomy, SPECT-CT, PET-CT, for example, adding the anatomical measure of coronary calcium or assessment of coronary calcium with the perfusion, I think is something that's growing in popularity for good reason.
And with the PET, do you think that there's any advantages to having a 75-second half-life for quicker scans in the additional myocardial blood flow information that you get from PET? I mean, is PET something that's going to outmode SPECT in the next 10 years, or do you think they're going to be working side by side?
I think we'll have them both for 10 years. The PET cameras are more expensive. There are barriers for people to get into them. You need a certain, certainly with the current approach, you need a certain volume of cases to be able to justify the expense and to get over the barriers.
Well, thank you very much for your time. I really appreciate it.
Yeah, pleasure.